My people are destroyed for lack of knowledge, and that is Hosea 4 and 6. And this Bible verse has been really, sitting heavy with me lately because I think about this in such a different way when it comes to healthcare. Too often people are taking medications and they don't fully understand them. And I'm not saying that people have to be like at, the pharmacist or the physician level of understanding, but you have to understand them enough that they become a tool for you and not something that can be detrimental towards you. The truth is that understanding your medications could literally save your life. And today I want to break down a newer class of diabetes medications, new-ish. They are called the SGLT2 inhibitors, and they really have been game changers, underrepresented game changers, because they have been overshadowed, in my opinion, by the GLP-1s. But in this video, I will tell you why they are game changers. Before I get into that, I do want to tell y'all a story because this conversation around lack of knowledge and making sure that you understand your medications is so important to me. I have plenty of family members, as many of you watching may as well, that have been affected by not taking medications correctly or not understanding their medications, going to the doctor, coming home, and not being able to ask the right questions that they need to ask just because they weren't aware of what maybe needed to be asked or in that moment just didn't feel comfortable asking the question. And my grandmother passed away because her blood sugar got too low. And we're always concerned with high blood sugars. But I tell my students all the time, a low blood sugar will put you in the hospital faster than a high blood sugar. And although my grandmother had been taking insulin for years, like she didn't fully understand what it was doing and how it was working. And what ended up being the issue for her was that she took insulin and didn't eat and didn't understand how that her blood sugar getting that low could be an issue, and she ended up in a diabetic coma and eventually passing away. And so I say that to say, my passion about making sure that people understand their medications is bred from life. And so I just want to have these conversations because if you're on an SGLT2 inhibitor or if your physician recommends one for you, or any of the medications for diabetes, I want you to be able to like pull up this video real quick and be like, let me see what it is this is all about. Or maybe you've already watched this video and you can say, hey, I heard about these. Let me ask you a couple questions. So I'll leave that there. If you've not watched any of my videos yet, my name is Takova Wallace-Gay. I'm a pharmacist in primary care, and I do not believe in people just swallowing pills and blindly trusting. I don't believe in people just taking pills if they don't need to. But my goal is if you need to take medications and you're going to, I want you to understand exactly what your medications are doing so that you can feel confident and empowered when it comes to your health. All right. So now I'm ready to jump into the conversation. These medications, pretty much all of them now, most of them for diabetes, especially the newer ones, it's not just about lowering your blood sugar. And obviously, we want that, but it's about the downstream effects because most people don't die of diabetes. They die of complications related to diabetes. So, that uncle of yours who ended up on dialysis after, his diagnosis with diabetes, because maybe it wasn't controlled or he had had it for a long time, or the heart attack that comes in somebody with diabetes, these are the things that inevitably are the detriment in individuals who have, I'll say, uncontrolled diabetes, because you can control your diabetes and be just fine if your numbers are looking good and everything's great. So today, again, in this video, I'm going to talk about SGLT2 inhibitors and what they are really all about. And to start off, I'll just tell you kind of, what they're for and all of their different purposes. So the medications in this class are Jardiance, Farxiga, and Invokana. And Jardiance is empagliflozin, Farxiga is dapagliflozin, and Invokana is canagliflozin. So you'll probably see the brand names Jardiance, Farxiga, and Invokana because they're not when we don't have them as generics yet. But if you happen to see the other name, I want you to know what they are. And I'll put those names on the screen. Most people, when they look at these medications, they truly just think they're diabetes medications. And yes, they are diabetes medications. They do lower the blood sugar. But the big twist with these medications and really how they're picking up and being prescribed is specifically for heart failure. So if you're someone who has heart failure, whether your ejection fraction is good, if it's, preserved or reduced is what we call it. And, you can ask for those numbers, like what did my echo say? What is my ejection fraction? That'll help you know if you have reserved or excuse me, reduced or preserved ejection fraction. But it's used for both of those. And not only is it beneficial in protecting the heart and heart failure, it has been shown to reduce mortality, death. Like, it reduces your risk of death. And so when I'm seeing patients in clinic and I'm like, okay, this patient has heart failure, my first question is, are they on the medications that are going to reduce their risk of dying quicker because of heart failure? SGLT2s do that. So if you have heart failure and you're not on a medication that ends in flozin, Flozin, have a conversation with your prescriber about it, because unless you have a profound reason why you cannot take the medication, there are very few reasons, then you need to be on one. The other big thing that people are being prescribed these medications for is chronic kidney disease, because they've also been shown to protect the kidneys. And let me just kind of go back a minute, because we know that these medications help in people with diabetes who also have heart failure, and also to help, with kidney issues. But even if they do not have diabetes, these medications can be helpful or have been shown to be helpful. So you may be someone watching this video and you're like, well, I don't have diabetes, or my aunt has heart failure, but she doesn't have diabetes. Go make sure she's on the Flozin. Go check up on auntie, make sure she's got the right medications. And again, these medications are helping with survival, which is, we all want to live our best lives. So how do they work? And it's actually pretty simple with these medications, in terms of just the overall functioning of them, because the kidneys at baseline filter out our blood. And when our blood is filtered out through the kidneys, our kidneys are like coffee filters. So there's stuff that stays in the kidneys and then it just gets peed out. And then there are other things that gets filtered through the kidneys and then goes back into our bloodstream so that we can use it later. So glucose, or blood sugar, is one of those things. And so when the blood goes down to be filtered by the kidneys, um, sugar gets filtered, but then it gets reabsorbed. Most of it, like 80 to 90% of the blood sugar, gets reabsorbed back into the body. And so if you have high blood sugar at baseline, you don't want all that sugar reabsorbed back into your body. And so what we do with these medications is we come in and we block the transporter, is what we call it, and it's the SGLT2 transporter. We block that so that now, instead of your kidneys reabsorbing it, it's blocked from reabsorbing, and you just pee out that sugar because it stays in the kidneys, doesn't get reabsorbed back into the blood. And so that's going to be beneficial, because now, instead of reabsorbing 80 to 90% of sugar, we're only reabsorbing about 10%, because most drugs don't do things like 100% fully, but they do things, really well. And so now you're only getting about 10 or so percent reabsorbed, which is great, because you still need sugar to function and you still need it for energy support and brain support and all of that. But what this means is that you're peeing out a whole bunch of extra sugar. Now, this is going to bring me to side effects, because just because it's a good thing, there are definitely going to be some trade offs. If you've got a bunch of sugar being passed through your urine, through your urinary tract, bacteria, fungi, things like that, they love sugar. They love to feast on sugar. So if you're peeing out a bunch of sugar, it increases your risk of having urinary tract infections. So when you're started on one of these medications, drink plenty of water. Like, just keep it with you. And that way your urine is diluted, and the sugar is not just kind of sitting there, for bacteria and things to feast on. And also, I literally say this to my patients, even though you are hygienic, just be extra, extra hygienic, and make sure that you clean yourself really well after going to the restroom. And that way you just continue to add an extra layer of support to make sure that you reduce your risk of getting urinary tract infections. And if you're someone who already gets urinary tract infections often, then we're probably going to abstain from giving you this medication unless the benefit outweighs the risk. So if you have heart failure and this has been shown to improve survival, we might go ahead and give it to you and then just kind of see how it does with, causing you to have a urinary tract infection. Because you are peeing out more glucose, glucose is like, we call it osmotic. So water follows it. So when you pee out more glucose, that means you're getting rid of more water. And so you may find yourself going to the restroom more often, especially if you have a lot of glucose to get rid of. And because you're going to the restroom more often, you're getting rid of more water from your bloodstream or from your body overall. You're just losing fluid. And also, sodium is going to follow water. And so you're getting rid of sodium. And so the good thing there is that your blood pressure may improve a little bit because you just are getting rid of a lot of the um, volume in your body that might be causing your blood pressure to be a little bit high. The bad thing is that you might feel a little bit dizzy. And also, you need to make sure that you're staying well hydrated, which I already mentioned for the urinary tract issue. Um, I'm gonna mention this, but I don't want you to put too much weight on it, and that is that there is a, like, serious side effect that you need to know about and just be cautious of, and it's called diabetic ketoacidosis. So most of the time, this presents with somebody's blood sugar being sky high, like 600. But even if your blood sugar isn't sky high, with these medications, you could still develop diabetic ketoacidosis. And I won't, get into what all of that means specifically, but basically it means that your body is in this like acidic state, and that can be toxic for you and cause issues and hospitalization and all of that. So you wanna make sure that you're just watching out and making sure that you're not getting too fatigued, you're not feeling just a general sense of unwellness, that your urine is I keep saying pee, but your urine is an appropriate color, so it shouldn't be like a brownish color or dark color. It may be slightly yellowed, but, if you're drinking plenty of fluid, then it should be closer to like a pale yellow. And finally, with this medication, we know that specifically Jardiance can cut the risk of dying from heart disease, and Farxiga specifically slows down kidney damage in individuals with chronic kidney disease. And then across the board, they all both Farxiga and Jardiance lower hospitalizations from heart failure as well. So not only are they improving survival, but they're also reducing hospitalizations. And so that's going to be really important. Invokana, it's the original agent in this class, and so it's a little dirtier, if you will. Like, as we develop more and more drugs, and I say we, I don't work for the drug companies, to be clear. Like, they do the studies, they have pharmacologists and people like that. But I say we as a health community, as we get more drugs coming out, they tend to get better and better with each rendition of that drug. Not always the case, but mostly. So Invokana was the first one. There were some like issues and side effects with that one that have been fixed with these other ones for the most part. So your doctor might prescribe you one of these medications, even if your A1C looks good, even if your diabetes is controlled, because we know that long term, the protection is going to be very valuable. I already mentioned this, but I will say it again. Please stay hydrated. If you're on one, drink lots of water because you will be losing fluid as you get rid of sugar. And we don't want you to be dizzy, and we don't want you to develop infection. And then also just practice extra hygienic practices, just to lower your risk of having a urinary tract infection. And it's less common with men than women just because the urinary tract is longer for men. But men, you can still, develop a urinary tract infection with these. Um, I didn't mention this earlier in the video, but these medications can also help you lose a little bit of weight. And so I do talk about those. Um, or some other medications that help you lose weight or medications that may be making you gain weight in a different video, which I'll link at the end of this one. That would be a good one to go back and watch if you haven't watched it yet, where I just go through some different classes of medications that help with weight or maybe causing you to gain weight if you're on them for diabetes. But this one does help you lose a little bit of weight, especially since you're literally just peeing out calories in the form of sugar. So I'll end with this. My people are destroyed for lack of knowledge. And the knowledge in this case is the thing that is literally going to keep some people alive longer and thriving, just because these SGLT2 inhibitors are changing the way that we treat diabetes. They are changing the way that we treat heart disease and specifically heart failure, as well as how we address kidney problems. But if you only know how they work w- and you don't know what to expect or how to use them safely, then you still have a gap in, awareness. And so I want you to not only know how they work, which I talked about here. I want you to know what to expect from them. So, what are the side effects? And then, what are the things to look out for with them as well? But also know how they're benefiting you, because when we know why we're taking things or why we're doing anything in life, it just makes us a lot more um, prone to do that thing correctly or do that thing well. And so, if you have any questions about this or comments, please let me know. My challenge for y'all is to not just take your pills, but to really understand them, because every pill that you swallow should come with clarity and not confusion. If you learned anything in this video, if it resonated with you, if you know somebody taking the SGLT2 inhibitor, and you got some information that you can share with them from this video, share it with them, click the like button, subscribe, and share it again with anyone who is managing diabetes. And if you need a tool to help with is kind of organizing all your meds together, I do have a free medication mind map. I've linked that in the description box below. It's just a tool. We know that concept mapping helps people with memory, retention, and understanding. And so I formatted a concept map in the form of a medication mind map. Um, Again, it's free. Grab that in the description box below, but it could save you lots of stress, lots of money, and just help you see the big picture around your medications. So until the next video, thank you, and consider watching this video next.